supports health promotion targeting gay and bisexual men living with HIV and those engaging in sexualized drug use. His involvement extends to various community organizations where he supports program implementation, campaigns, research, policy development across the sector. Bo Justin currently serves as a board director at the National Association of People with HIV in Australia and as a network advisor for the Positive Asian Network Australia. I'll pass it on to the two of them to present. Thank you.
Thank you, Vikas. When you asked me to send you my bio, I just copied it from LinkedIn, and then I realized it's probably a bit too much for a forum like this. I'm also a community member. I'm a migrant, a person of color. I'm a gay man. I'm someone who uses drugs, and I'm HIV positive. And I think for me to be here tonight and talk about our services alongside Glenn, it's really meaningful, and just really excited to be here. So I'll share my slides, right? So we can get started. Just give me a second. Oh, pass to you, Glenn.
Thanks, Bo Justin. Okay, so I just wanted to talk a little bit about who we are at ACON. If you haven't heard of us before, we were founded in the mid-80s in the height of the HIV/AIDS epidemic that was in our community, and the rest of society didn't really know how to help us through this. So it was started by a bunch of gay men and lesbians, kind of basically, and trans people who came together to provide support for people who really needed it in our community. So over the last 40 years, the direction has sort of changed slightly, and we've opened up to different sections of our community and are basically recognized as the experts in our field and funded to help out the health and well-being of most of our community. We work with people from a diverse cultural, ethnic, and linguistic background. And we generally, the people that are working at ACON, are members of the community. We're gender or sexuality diverse, or closely connected to the community in some way. We come from a bunch of diverse cultural backgrounds. We're a multidisciplinary team. We're social workers, psychologists, counsellors, peer workers, and a few other experts kind of thing in our field. So the people that we do support and who we are here for are people over the age of 18. There's other services that looks after people that are under 18. Because of our funding, we look after people living in New South Wales and who identify as part of the LGBTIQ plus community or their families, friends as well. We've got 3 offices. One of them's located in Surrey Hills in Sydney. We've got an office in Newcastle and also in the Northern Rivers at Lismore. But these days we are doing telehealth appointments for anybody living in New South Wales. So as I said, we'll just run over some of our programs that we are offering. This is sort of the legacy work of ACON, where we really started doing our work was the Community Support Network, which is run by a whole bunch of dedicated, wonderful volunteers to support people with HIV in their homes for practical support, and that's once a fortnight. We're always looking for new volunteers as well for that service. So if anybody is keen to participate in the community, that's a great way. We've also extended that kind of service into our aged care volunteer scheme as well, which visits older members of our community in their homes or in an aged care facility to provide them sort of peer connection, friendship, and support through sort of social visits on a fortnightly basis. Another one of our services that we offer is care coordination. So basically, this is our social workers. They support clients trying to access basically the government services that are available. Stuff around healthcare, financial support through welfare and Centrelink, social connections through to housing opportunities, disability and legal support services. So yeah, our social workers help people navigate through the systems that you have to get through to access all of the services that are available. This is a free service that's funded by the Ministry of Health.
Okay. Before I talk about our peer HIV support, I just want to, I guess, check in with Glenn. So in those early days, I guess HIV looked quite different and compared to like today. But at what point did people reach out to ACON, or like, did they not trust the other services, or was it just kind of the reputation we had, or what made them reach out, and at what point did they reach out?
There was all sorts of different points that people reached out. Some would reach out at a diagnosis, when they got an HIV diagnosis and look for sort of help. At the time, people were getting thrown out of their accommodation. So also, ACON helped them access housing and appropriate sort of facilities to help them set up a new home for themselves, and would provide advocacy to governments and government departments to get that set up. And yeah, there was a lot of people in the community that were really unwell as well. So ACON did provide services, getting them to medical appointments, getting them to hospital, because at the time, HIV and AIDS was very scary for a lot of people. It was difficult to get a taxi. It was difficult to access hospitals in a lot of parts of New South Wales. So ACON facilitated that a lot with people and were called on to do that kind of work.
It sounds like that's the common experience of, in this instance, suffering or experiencing injustice that made them rather connected. I ask that because I think in the community health sector, we often define peer in a way that's based on a particular measure. Is you both HIV positive, or you both use drugs, you're both from South Asia, East Asia, and often through program delivering, I think what we found is these days we're actually looking for a more meaningful definition of peer. Like Glenn said, A-Start is our peer support program for people living with HIV. It's actually started in the 1990s, purely as a newly diagnosed group. But I think in the last 10 years, this has changed a lot, where we've seen clients who have been living with HIV for years, but haven't met anyone who's also positive due to the stigma. So that workshop, we talk about disclosure, we talk about treatment, and HIV stigma and dating, and also just, I guess, everyday life. And it's a great way for positive people to meet others. Some may have more similar experience to your diagnosis, some may not. But it's being held, I think, between 2 to 3 times a year, and generally people really appreciate the space to be seen. And for people who are less less open about their status, we also offer a one-on-one peer navigation. So pretty much we deliver the same kind of content, but on a one-on-one basis. And the last kind of arm of our HIV support program is our community forum. Vikas actually has been one of our guests, talking about HIV and immigration. So every 6 months, we kind of hold a community forum to discuss things that might still be relevant to positive people, or that something that they're interested in. And that's pretty much our HIV peer program. And I think because the strong connection people have got from attending ACON workshops. Around 10 or 12 years ago, we also started this testing service called A-Test. It is partnered with the local health districts. We provide free HIV and STI testing to community members. It's a free and confidential service. I definitely recall when I went to my first STI testing back in Asia, like what kind of horrible experience that was by just disclosing that I've had sex with more than 2 men, maybe. And I guess that kind of judgment really stopped me from wanting to get tested more often. So one thing that A-Test does really well, and we take great pride to, is, I guess, the peer consultation part of the testing service. Peers will do all the STI screenings and explain the process. They'll do some health promotion and then you'll be collecting your samples, and by the end, nurse will see you. Usually, you can get in and out within 15 to 20 minutes. And currently, we have 3 locations: one on Oxford Street, just near Stonewall, and one in Surrey Hills in the ACON office, and there's one in Newtown, I think opening in 2 weeks. Cool. Back to you, Glenn.
Okay, so another one of the services that we provide at a free or a very low cost, depending on the circumstances, is our LGBTQ and HIV counselling services. These are open to all the members of our community. It's a 12-session model, so it's 3 months worth of therapy that we provide. And it's for any sort of problems that people are having in their lives. We see a lot of people that are experiencing symptoms of anxiety and depression, issues around their sexuality, general sort of work issues, stress management, all the kind of things that might be helpful to talk through with a counsellor or a therapist. We prioritize certain categories of people that are listed off there. People that are Medicare ineligible, people that are HIV positive, at risk of suicide. So we operate that during the week. We also have an after-hours service that's staffed by recent graduates, either psychologists or counsellors, and they operate a couple of nights during the week where they do a couple of appointments each. And it's sort of how I started my gig at ACON as well.
I do have a question from the audience about some of the mental health services, Glenn. The audience asks, how does ACON, or how can ACON provide psychological support to people applying for protection visas based on their sexuality?
Yeah, we absolutely do provide counselling services. We have a huge part of our clientele is on a protection visa at the moment. I was talking to one of our counsellors actually today that the majority of her clients are in that situation at the moment. So we can help people sort of acclimatize to life in a different country and sort of work through some feelings that they might have around the changes that they're experiencing and the difficulty of going through the visa process, which we all know is extremely stressful. So we do absolutely can help people in that situation and provide some support in that kind of way.
And if do they come via self-referral, or what would be the referral process for them to access these services?
Yeah, but for all of our services, we do have a centralized intake service that they can. There is a form that people can fill out online, but most of it we do like to actually talk to somebody just to run over what they're looking for, so we can match them best with the service that is available. So I think we've got a slide towards the end with our phone number and contact details on it. But yeah, you can get us through the ACON website as well.
Great, thank you.
Okay, so another one of the services that we do offer is for people that are willing and able to pay. There is a subsidy available through Medicare if people have a mental health care plan through their GP. So this is a social enterprise counselling model that we're using, where the profits are going to unfunded or underfunded support services that are around. There's also the service that we provide, the sexual, domestic, and family violence service. When we use the term sexual, domestic, and family violence, it is an umbrella term. It doesn't just mean sexual abuse or physical violence. It's for people experiencing difficulty in their relationships. Difficulty in their relationships where they feel a little unsafe or feel fearful, kind of thing. We've just expanded this service in the last few months, because there is a recognition that within our community that it can require some specialized services to understand the nuances of same-sex relationships or same-gendered relationships, and how that how abuse in those relationships can look and how that sort of feels. So our workers will provide support to people through sort of counselling. We also run a group for survivors of domestic violence. We connect people with healthcare, safe housing, social connections, financial and legal support services to get them through this difficult part of life, and connect them up with longer term services that are available as well.
Elena, I just want to ask a question. Like, I think to a lot of migrant communities, the concept of intimate partner violence or even family violence can be really unclear. You know, as a Chinese son, like I grew up with domestic violence and like harsh love and all that. And I guess there's this kind of understanding that is how our parenting is. So I wonder, in this particular service, like what do the workers actually do? Like what do they talk about?
Maybe it is a very Western concept then as well, that we expect most relationships for people to have a mutual sense of respect for each other, that people don't feel manipulated or obligated, kind of thing, within their relationship. We do work with a lot of people, particularly in the migrant communities, where being outed is more of a threat, with intimate sort of domestic sort of violence, kind of thing. And yeah, the workers will sort of work through trying to create healthy relationships for people, or what we view as healthy relationships for people.
Sure. I
Yeah.
guess what I mean is, when I see the term domestic violence, I think I must be in hospital in order to access this service. Is that by the sound of what you just said, like that's not true, right?
No, it's if you feel fearful in your relationship, we don't think that's particularly healthy way to be.
Oh, apparently a lower threshold than I thought.
Yeah.
I think peer work in mental health is one of those things that's been talked about a lot, and there's a lot of interest in the sector, but it's still a kind of relatively newish kind of role, especially in the mental health, like the mental health space. As an organization, we always try to expand our service and work collaboratively. The mental health peer work is a result of, I guess, working with community and listening to their needs of like wanting to connect to people who have the same or similar lived experience. And that's pretty much what exactly our mental health peer do. A lot of them provide trans affirming peer support it's a non-clinical support service. Some of them work in the suicide prevention space as well. And it doesn't mean they have to stop seeing their counselor or therapist. These two can sort of go together and yeah, complement each other in that case.
Okay. Can I just answer a
this
question
is,
before we go on, Justin?
Sure.
There's a question saying, what sort of financial and legal services does ACON provide to survivors of abuse? I've heard a lot of stories of victim blaming within the services. So I just wanted to respond to that to say, ACON doesn't provide actual financial or legal services to people, but we do facilitate connections to legal services that we deem suitable for people in same-gendered relationships, and similarly to financial support that, again, the government does provide through victim services and sort of those things. So ACON workers will facilitate, help people, point them in the right direction, make them clear of what the requirements are for that kind of stuff and how they go about applying for them, and help them with any problems they have with that application. So yeah, I just wanted to, and I hope that clears that up. If there's anything that I haven't mentioned, yeah.
Thanks for reminding me. I didn't even look at the chat. It's going on.
There's also a question about, is there statistics on which ethnic groups are more affected by some of these issues? Not that there absolutely is. I just don't have them to hand. I could, I could find a paper to feed back to you guys that does sort of express that a bit.
There you go. That's your homework.
Yeah, damn. Okay.
Substance support counseling.
Yeah, this is where I do the majority of my work. It's for alcohol and drugs. The reason we have this facility at ACON is we recognize that people in the LGBTQ plus community have higher rates of harms associated with alcohol and drug use. A lot of our social connections are based around alcohol or other drugs. So this is harm reduction model that we use. So we're not making everybody become abstinents, give up drinking or smoking or whatever their drug of choice may be. This is a free service that we provide. And I guess it's worth mentioning, this isn't just for people that have a significant, that identify they have a significant problem. If you want to talk about any worries you have about your alcohol use or your other substance use, that's what we're available for. That you don't have to have a massive problem, but if you want to talk about it with somebody that knows something about this and knows some strategies about ways to manage this kind of stuff, then we're the place to come to. This is also if you have family members or friends, or when I say family, I kind of mean chosen family, not necessarily blood family. But if you have people that you are concerned about and want to get some advice or help on ways to talk to them about their substance use, again, we are there for that kind of support to people. You're on mute.
Sorry, I'm really embarrassed about that. I think because Glenn's team was really successful at working with community, in particular gay and bisexual men who engage in chemsex or party and play, we were able to identify like this peer program that particularly supports gay and bisexual men who use meth for sex. And we started 5 years ago exactly. Started from just providing one-on-one peer support, through brief intervention. And I want to talk a little bit about my lived experience here, because when I first started using drugs for sex, I tried to access services, and the experience was actually quite daunting as well. Like me being a 21-year-old migrant going to a facility, like looking at people who use substances that are not the same as mine, and they use it differently. Like I didn't really get the right information that I needed when I was a young person. So one goal for us when we design this service is to create a space where people can actually talk about their drug use and sex and not feel judged, and be that stepping stone for people to go on and seek professional support if that's what they need, or work on their personal goals. Yeah, so we've been delivering this service for almost 4 years now. And again, we also follow a harm reduction approach. We really kind of put our clients in the driver's seat. Not everyone who uses drugs has to be in a crisis mode at all. Like most people can manage their drug use, but when things get a little off the rail, like this is usually a great time to kind of just have someone to check in with and to even verbalize your concerns. Yeah, like most other services, it can be delivered in person, online, and we provide this sort of self-reflection and goal setting exercise, and we do harm reduction in education, and then obviously we refer people on to services that may be what they need. And I think over the years, Glenn's team and my team also kind of built a beneficial, like mutually beneficial working relationship. So we were able to kind of work a lot closer. And this is the method group. So this is a group workshop for people who engage in chemsex. It's facilitated by actually Glenn and I and another peer worker. So I guess it's not often we see clinicians and peer support workers kind of like delivering the same program. We've tried it 2 and 3 times, and we think it's a really good approach to work with this particular community. You know, like there's the connection that peers can bring, and then there's the therapist kind of like clinical advice that can sort of just complement the content. Yeah.
I'm glad you're talking about this, Justin. There's a couple of things that I wanted to mention. There's studies that we've discussed in the Trikone Health Committee, which talk about the high rates of HIV infection amongst migrants, and also similarly the high use or the high incidence of sexualized drug use amongst migrants from the LGBTIQ communities. And I guess it would be good to know what are some of the types of harm reduction methods that ACON uses in providing its services to reduce those rates of HIV transmission with education, for example, or referral to STI clinics, those sort of things, and also to address sexualized drug use.
Yeah, I think Glenn will jump onto this one too, but I think from my side, HIV prevention is a lot easier these days compared to maybe 10, 15 years ago. Like we have PrEP, we have PEP, we have undetectable viral load. You know, all of these things can prevent HIV transmission. I think that the barrier is when migrant or international students come to a new country, often speaking a second language and trying to find a sense of belonging. From what our clients have told me, the common theme is I didn't know I could say no to the drugs I was taking. I didn't quite know what it was. I didn't know what it would do to me. I wanted to feel accepted and sexy and almost celebrated, and I wanted to let loose because I have a lot other things to deal with in my life. So, you know, like they made the choice to, I guess, enjoy life, to feel human, and then to feel good, which is a very human thing. It's a very natural thing to do. To use drug is not the end of the world. I think as a peer support person, my role is to make sure that clients have the right information and they can make informed decisions about their choices, and and also learn how to do it in a controlled manner. So how do you calm down better? How do you plan your sessions? How much do you want to use? How long do you want to use? How much money are you willing to spend? So all those things all kind of add up into someone's chemsex experience. And as we all know, that the more tools someone has, that the better outcome they may experience. But yeah, Glenn.
Yeah, and I think you're right, Justin, that the more information that we can provide to people, it lets them make informed decisions. If we explain to people the difference between drugs and the impact they have, it allows them to decide for themselves what's right or not. And I think, what you touched on around a feeling of connection and belonging has a real impact on the migrant community, kind of. Yeah.
Thank you. I believe there's a question from
Yeah.
the attendees,
Great.
and I'll read it out. Does ACON liaise with GLLO officers? Can they facilitate or assist in the process of obtaining an AVO? I think that's the gay and lesbian liaison officers that are often at police stations.
Yeah, that if people didn't know, quite a lot of the police stations have a gay and lesbian dedicated officer that you can ask to speak to a GLLO officer, and they will definitely help you with a more understanding and sometimes sympathetic view of what you're going through. Again, ACON can absolutely help facilitate a contact with a GLLO officer. We work with people that are going through the process of obtaining an AVO. So yeah, we don't, again, it's for our domestic violence sort of program, they are more facilitators and will guide you through the process. They can come with you occasionally and if it's required to help you sort of make these kind of things. But we do try to empower our clients to take the action that they feel sort of necessary. So yeah, we can definitely help with people that are in a situation where they feel a need to sort of make an apprehended violence order application.
Great. One other question I'd ask on, I guess, behalf of everyone, and I'll be speaking to this in terms of the legal requirements a bit later on today. But what confidence can you give our communities when they approach ACON for services about their confidentiality and how their personal information will be kept private and you know.
Yeah. We are governed by a strict set of health laws, which I'm sure you will explain a bit more, Vickers.
Yeah.
Yeah. You can also choose to access ACON services under a pseudonym. If you don't have to give us your real name if you choose not to. We are both ethically, morally, and legally required to maintain confidentiality. We keep all of our records in a secure database, we abide by all of the laws, which are particularly strict when it comes to HIV and health records. Does that answer that enough?
Yes, absolutely. And Just going from there, one thing that I note that you mentioned earlier in your presentation is issues that people face coming out and people sort of using that as a form of violence to intimidate. Are there any services? So a lot of our community come from backgrounds where perhaps coming out isn't easy. Are there any workshops or assistance that ACON provides in assisting people to come out?
Yeah, we have. But Justin, do you want to speak to this?
Sure. I think at different departments at ACON, peer education team, they do a lot of workshops for gay and bisexual and queer men. I think there is one called Start Making Sense, which is a workshop supporting people who are coming out or who want to learn how to come out again, like at a later stage in life. And I think sometimes they also do it based on cultural groups. So it was not long ago, they had a Middle Eastern group because there are particular cultural values and religious values that Middle Eastern people share. And, like, so again, go back to what I said earlier, is trying to, I guess, define the nuances in the peer connection. Yeah, but I'm, and there's an Asian group as well. That's I think that's a more sex-oriented workshop called Ask Class, or is it still called Ask Class? Something like that. It's about anal sex. Yeah, I think it's called Ask Class.
We also have workshops around meeting people online and
oh yes, sure.
go around that.
There's also what is it? Looking for Mr. Right workshop? Yeah, there's that too. Happy to send some links to Vico, someone later, just to share these opportunities as well. I'm aware of time. I know there are other speakers too.
There's a couple of questions, babe.
Yeah.
Yeah, there's a question on the Q&A. Someone asked, does being on PrEP prevent you from getting other STIs other than HIV?
No, it doesn't. PrEP prevents HIV transmission when used correctly. There are, I guess, possibilities for doxy PEP to be used, but it's not largely in practice yet. So we kind of don't talk about it yet.
Thank you, Glenn and Bo. I just want to throw it out to any other person in the panel who might have a question before we switch to our next speaker. Well, Alan has a question. He asked, "What is doxy-PEP, and does ACON support this?"
I don't think I can talk about whether ACON supports it or not. I think ASHM is the leading kind of agency that might have a view on this. So doxy-PEP is basically a antibiotics that you take after exposure to risk, and that sort of prevents you from getting, I think, STIs like chlamydia mostly,
and syphilis.
And syphilis, yeah. Okay, see, you know more than me. That's why I shouldn't be talking about it. Yeah, and I'll leave it right there.
Yeah. Thank you both very much for your time today and for joining us on the evening before the holiday. So, if no one else has questions for Glenn and Bo Justin, we can let them go and thank them profusely for their time.
That's been a real honor, Vickers. Thank you for having us. We really appreciate your time.
Thank you.
Thank you, everyone. Have a good night.
Thank you. Thank you, everyone. I hope everyone enjoyed that as much as I did. Next, we've got Kirk, who's actually a member of our Trikone Health Committee. He is a psychologist working out of the College Street Medical Specialist, Darlinghurst, and he has a major focus on LGBTIQ health, and he'll be talking to us about issues that affect LGBTIQ people in relation to mental health.
Thanks, Vikas. So just to follow up and tell people a little bit about what I'll be talking about, I'll just share my screen and just bear with me if this doesn't work straight away for me. Technologically not the greatest, but I'll try my best, and that's what we can do in life. Here we go. Just give me a shout out if that's working.
Yep, that's working.
Great. Okay, so I've been working with mental health since I was 19. So God, that shows my age. Over 15 years, I've been in the mental health space, predominantly drug and alcohol. So I've been working with drug and alcohol addiction, or people with suffering alcohol and drug addiction, for quite some time, and supporting their families. So it's quite second nature to me. I mean, I'm obviously coming at it from a lens of being and working in the LGBTIQA plus space, and I work quite closely with ACON, Scarlet Alliance, Trikone, to support our community. Today, I just kind of wanted to go over a little bit about what I might experience with people presenting to me, and maybe just some of the statistics around some drug use that I've found in my practice that was quite common, and some of the things that were quite noteworthy. So this is just a little bit about what I predominantly do. I'll focus a lot on, I guess, drug addiction in my practice, but I also, out of the College Street Specialist Centre in Darlinghurst, focus on relationship issues, general mental health, trauma, maybe other mental health disorders. Sometimes people present to me and they're not necessarily sure what's happening for them. They just know that they're not feeling the greatest, and the best option for them is to go and speak to their GP, get a mental health care plan, and get a referral to a psychologist. I also support people with disability support, so that could be NDIS packages, and working through accessing those by integrating into other services. We've got access to LACs that we can refer to and support people in getting onto NDIS. The other part of my work has been not only just addictions focus or people living with addictions, was working with quite complex mental health issues, or people with complex mental health issues, where they're struggling to access services. So I've been very community-based and working with community organizations for most of, if not all of my career. So the knowledge and work experience that I've got, I use that in my therapy as a psychologist, and I basically try and stabilize and support people in their living situations first and foremost, so that they can feel supported to work on their mental health and start to prioritize some of those things that might have gone unchecked in their life. Perhaps they're not in the space to give up their drug addiction. Maybe they're not ready to leave that abusive partner. Maybe they're not ready even to perhaps work on their mental health until they resolve their gambling issues. So that's the sort of thing that I would typically see with people presenting to my service.
Kirk, there is a question. Which is, what services and support are available for those with sex addiction?
Good question. So there's a range of different services for people with sex addiction. So one of the most common, I'll speak generally and then I'll speak more specifically about LGBTIQA plus support. But one of the most common is for people to access sex addiction Anonymous. So that's a general group for the community. You can actually type in Sex Addiction Anonymous on Google and go to their website. That runs from, I believe, a step model. Not to go too far into it. I'm not familiar with the steps. The other option is to go to a smart recovery group, which is what I'm trained in. So Smart Recovery is an addiction program that's in the community, and you can actually go onto the Smart Recovery website and have a little bit of a look at the different local groups. And they've got LGBTIQA plus specific groups, female-only groups that are actually advertised as such on the website. So you'll type in your local area and you'll be able to go to this. And I believe, and I try not to step on toes here, but I believe there's a rainbow room. If you type in rainbow room, which is in ACON's realm. So if you contact ACON, they've got ties with rainbow room. I don't know where their new location is, but I believe that one also works from a step model. Or the other option is counseling. So coming to a psychologist such as myself, working with a sex therapist, there's many options available. Hope that answers your question. So with some of the things that we're seeing in the community at the moment, we're seeing a lot of tobacco use. So the most common reason that people might, vape use. We're seeing vapes everywhere now. You know, there's been a recent crackdown on vapes. So I don't know what people are going to do with their mango flavored vapes now. But it was interesting to see, this is actually taken from the Australian Institute of Health and Welfare, most recent survey 2022 to 2023, that the most common reason for vaping was actually boredom, which was quite surprising. So there was just a few statistics there about tobacco, and I'm just mindful of our time, so I won't go through those. This is actually relevant to our community, the LGBTIQA plus community, is 2.6 times more likely to have recently used cannabis than the heterosexual community. So here's some statistics. I guess what we've seen in the blue line is the homosexual and bisexual communities just above the green line. So this is just something to have a little bit of a look at out of interest. With alcohol consumption, I guess this is one of my really common presentations and concerns that people come to me with, is that they're noticing that their alcohol consumption is increasing, and or their alcohol consumption is impacting on their functional lives, their occupation. It's impacting as such so that they actually have reduced function. So what we can see here is that LGBTIQA plus people are 1.2 times as likely to exceed the risk guidelines, which when compared to the heterosexual community, we're a little bit more at risk. And we're 1.3 times as likely to consume more than 4 standard drinks a day, at least monthly, than the heterosexual community. Just in my area, just work, I've worked in rehab environments, and I find them to be incredibly supportive. So rehab environments don't necessarily have to be inpatient. They can also be outpatient, where if you still have to hold a 9-to-5 job, or you still have to work, and you're still finding that your drug and alcohol addiction is getting a little bit out of hand, this is a really good space for you. And you can perhaps do an outpatient program. And if you can't afford private psychology or counseling that's subsidized through a mental health care plan, you can still access subsidised services or free services through these following organisations. And I've actually worked with We Help Ourselves, and they're a fantastic organisation for outpatient programs. There's some contact details. I'll leave these here for people to have a little bit of a look at. And you just call and they'll go through an intake, and you just have a bit of a chat to them about what's going on for you. But they're specifically drug and alcohol rehabilitation with a focus on both inpatient and outpatient with a detox attached. And I won't go into the details of what a detox is. Another organisation I've worked for, which is fantastic, is Odyssey House. So similarly, Odyssey House have quite a number of rehabs. The Eagle Vale one, I believe, is the closest. And there's some details there, their number and email. So all you do is just call and likewise complete an intake, and they similarly have a detox attached. And I'm just mindful of the time, so I'll just finish up there. Thank you, guys. Thank you, everyone.
Thank you for that, Kirk. That's very, very informative. It's good to know that there's various services people can offer for rehabilitation. And I'm mindful of the time, but I'm meant to go next. I guess I'll introduce myself a little bit. I'm a senior solicitor at the HIV/AIDS Legal Centre in Sydney. We are a specialist community legal centre that provides free legal advice and assistance to people living with HIV-related legal problems in New South Wales and beyond. Now, my expertise is in a number of different areas, but today I'm talking about privacy and discrimination. Now, you've heard ACON talk about the fact that they uphold confidentiality and the steps that they take to protect your privacy. But I guess I'll talk to you a little bit about how the law protects it. There are privacy laws, New South Wales privacy laws, as well as federal privacy laws. So more often than not, every service provider that you'll encounter will either be subject to the New South Wales law or the federal law. So for private companies, largely they'd be subject to the federal law, whereas for the health-based organizations or the health-funded organizations in New South Wales will be subject to the New South Wales law. And basically, it's as simple as the fact that any information that you provide to them can only be used, disclosed, or collected for the purpose that you've provided it. So, for example, if you're going to a counselor or you're going to ACON or you're going to a social worker and they've taken your information to provide you counseling services or social work services, and they're holding that service, that information for that, and for any other reason that they're telling you they're holding it for, they cannot then use that information or collect it or disclose it for any other purpose. And there are penalties associated with that. So if you've come across a situation where you've disclosed private information to a service provider, even an employer, they can only use that information in a certain way and something without your consent, really. So there are ways that you can make complaints about that. Now, a complaint for a privacy breach generally must be made within 6 months of when you become aware of the breach. So there is that time limit that exists, and usually it is to the service provider itself. As in the first instance, it's called an internal review. So if someone from let's say New South Wales Health has disclosed private health information about you to someone else at a public hospital or at a public clinic or a sexual health clinic, then you can write to them to commence an internal review, and that if as a result of that internal review you're not satisfied with the actions they've taken, then you can escalate that matter to the New South Wales Civil and Administrative Tribunal, which has various powers to provide compensation along with disciplinary actions against the person who's committed the breach of privacy. So just be aware that there's, in addition, in the federal level, you've got the Office of the Privacy Commissioner, who you can make a complaint to. So when accessing these services, just be aware that you've got rights, and they have to keep the information you provide to them private. Otherwise, there's legal action you can take against them, and there's various services you can seek for advice on that if your privacy has been breached. Now, the other thing I wanted to discuss was if you come across an instance where someone has discriminated against you because of either your sexuality, your gender identity, your race, your disability, your HIV status, that is unlawful discrimination both under state law and federal law. And so you can make complaints about that. I'll just briefly explain what discrimination is for the purpose of the law. Discrimination is when someone either denies you a service for one of those reasons. So if someone denies to provide you service or employment or housing because of your HIV status, your sexual orientation, your gender identity, your race, then that's unlawful discrimination. That's called direct discrimination. The other form of discrimination is called indirect discrimination, which is where if someone is providing the service to you, but they're providing it to you on terms less than those provided to someone without that. So for example, if they've provided you a service on lesser terms than they provide to someone of a different race or different sexual orientation or a different gender identity. So it's not just that they deny you a service, but they offer you a service in a way that disproportionately affects you because of one of your protected attributes. And you can make complaints to Anti-Discrimination New South Wales if it's a state-based entity, or the Australian Human Rights Commission. For employment matters, you can also take it to the Fair Work Commission, but the strict time limits that apply for that, it's 21 days if you've been dismissed from employment. Okay. There's a question. It says, how would you be able to prove discrimination based on sexuality, ethnicity in court? Look, you're right that is an issue. How often someone might not exactly say to you that the discrimination is because of your race or your sexuality, but sometimes it becomes apparent from the language that they use. So they might use a slur of some sort, or they might say things like "people like you" or those sort of terms, and you can sort of ask what that means. Sometimes people are really stupid, and I give this example from my work. Because I work with people living with HIV, and they'll go to a service and they'll say, "Oh, I'm sorry, because of it's a service that there's blood involved, so we can't provide you a service because of your HIV positive status," and that amounts to discrimination. So sometimes it's quite obvious. You don't necessarily have to have a witness to the discrimination you faced. You can provide a statement which outlines what was said and what you heard and what the service was that you weren't provided, or what the terms were that you were provided, which were less. I'll give you one example. Someone I know, a client of ours, was told that because of their HIV status, they could only attend the clinic at the end of the day when no one else was around. So that was considered to be discrimination. You are right. In some circumstances, you'll never know that you've been denied a service because of that reason. But sometimes you could just ask, "Why am I being denied the service?" And people are sometimes stupid enough to tell you the answer, and that their response is something then that can be used in court and form part of your evidence. Okay. I know we've gone 5 minutes over time, but really I just wanted to make you aware that there are rights that you have under discrimination laws and under privacy laws when those situations arise. There's a few, if it's specifically LGBTIQ related discrimination, you can contact the Inner City Legal Center. They've got the statewide funding to provide free legal advice on LGBTIQ related issues. And also, if the discrimination is in an employment setting, then you can go to the Kingsford Legal Center, and they've got statewide funding for discrimination in employment settings. And lastly, if it relates to your HIV condition, then you can contact the HIV/AIDS Legal Center where I work. So that's all I have to say today. Unless anyone else has further questions, we can wrap up. Thank you all for attending. Thank you, everyone. Have a good evening.